So now let's discuss the healthcare needs of foster children. The American Academy of Pediatrics has classified children in foster care as a population of children with special healthcare needs due to the data from the last 30 years demonstrating the high prevalence of health problems. A government study that compared children receiving Medicaid who were in foster care with those not in care found that the children in foster care had much higher rates of developmental disorders, certain medical disorders such as vision, teeth, and jaw, and a number of behavioral disorders, including attention deficit and adjustment disorders. This same study showed that youth aged 12 through 17 in foster care had 3 times as many behavioral and mental health diagnoses and were more than twice as likely to require inpatient care of any kind compared to youth not in foster care. So, ideally, children receive a full mental health evaluation, including a trauma assessment, shortly after entering foster care. A mental health screening to assess for suicide risk and acute mental health needs is also important at the entry of care, but a full evaluation is best conducted after the child has had some time to adjust to their new living situation and visitation with family. If treatment is indicated after evaluation, it should incorporate appropriate therapy, including trauma-informed care, with appropriate education and support of the child's caregivers and caseworker. But there are some barriers for children receiving care, and that some barriers foster youth face to receive care is care coordination. Care coordination is particularly difficult for children in foster care because of the transient nature of the population and the diffusion of authority among parents, child welfare professionals, and the courts. Receipt of healthcare is often fragmented and crisis-oriented rather than planned, preventative, and palliative. In order to create a foster youth-friendly office in the medical home, staff can provide information about managing health problems and emotional, behavioral, and developmental concerns, identify resources, and coordinate referrals. We can also be advocates for children in their care to ensure that each child's needs are met, screen for signs of abuse and neglect at every health encounter, remain alert to the quality of caregiver-child relationship, and share any concerns with the child's caseworker.